When we are faced with a major healthcare decision, there are three general approaches we can take. First, we can try to prolong our lives for as long as possible. This may be through medications, treatments like dialysis, procedures like surgery, devices like a ventilator, or a combination of these. The goal of this approach is to maximize the number of years, months, or days that we are alive. For much of our lives, this will be the clear and most appropriate approach to our healthcare. Of course, we will also strive to make ourselves as comfortable, pain-free, and functional as possible. But the primary goal of this approach is either cure or just living longer. Whenever we are living with illness, our treatment plan should include attention to palliative care. Palliative care is a specialized form of healthcare that focuses on relieving the symptoms and stress of illness. In the case of chronic or serious illness, it is often provided by an interdisciplinary team. Palliative care is appropriate for patients of any age, from newborn babies to people over 100. It is also appropriate at any stage of illness, whether we've just been diagnosed, whether we've been living with the illness for decades, whether we're experiencing an acute short-term crisis, or whether we're nearing the end of life. Palliative care can and often should be used in tandem with life-prolonging treatments. But sometimes, like when we've been living with a serious illness for a long time, or when we have become very frail and our chances of recovery are quite low, our goals of care might shift, and we or our agents may choose to focus on quality of life versus quantity of life. The second approach to healthcare decisions that we want to talk about today is often called comfort-focused care. The goal of comfort-focused care is to make us as comfortable as possible for the time we have left to live, without necessarily prolonging our life. If it is very unlikely that we will recover from a serious illness or injury, or we have severe symptoms that are hard to control, we or our agents may see this approach as the better way to maximize our quality of life. Hospice is specialized, comfort-focused care for people who are terminally ill and likely have 6 months or less to live. It provides medical and nursing care, as well as spiritual and psychosocial support that is uniquely tailored to the end of life. Like palliative care, hospice focuses on controlling pain and managing symptoms. There are a lot of misunderstandings about what hospice is, and sometimes we hear people say they think it means giving up. But this is not the case. Hospice is simply designed to improve quality of life for as long as life lasts. A third approach to healthcare decisions is called a time-limited trial. With this, we can agree on a length of time to try one or more life-prolonging treatments to learn whether they support our current goals of care. At the end of that time period, we or our agents can make an informed decision about whether to continue those treatments, switch to different life-prolonging treatments, or switch to comfort-focused care. It is important that your agent understands your thoughts and preferences about these different approaches. You can use your healthcare directive as a way to share your wishes. The next videos will share more details about some treatments that your healthcare agent might have to make decisions about on your behalf. We hope these videos will help you think through how you would like your agent to respond if they ever have to make these decisions for you.